A little known fact right there.
Yep. I've handled all sorts of animals, but
Started.
okay.
Well, welcome everyone. My name is Veronica Sutton and I am your Vice President of Education for PSALA. I'm also HR Director at Hillis, Clark, Martin, and Peterson. We have the honor today of being joined by not one, not two, not three, but four of our chapter business partners to talk with us about the Washington long-term care tax that's on the horizon and all sorts of questions on what is it, what does it mean, how do I get out of it, can I get out of it, how do I administer it, what do I need to know? So there's going to be a lot of what do I need to know, and these guys are well equipped to be able to answer that. So I just do some quick introductions here. First, I'd like to introduce our gold sponsor, Hub International. We've got Dave Jones with us from Hub. Also our bronze sponsors, AHT Insurance, Parker Smith and Feek, and Pillar Insurance Advisors. And I'll go through here kind of who's with where. And thankfully, it looks like Connie and Karen actually have their logos up on their screens. So as I mentioned, we have Dave from Hub. Dave Jones is Vice President and Life Practice Leader, or Vice President, Life Practice Leader and Benefits Consultant. He joins us from Spokane today. Next, we have Noel Evans from AHT, where he is Director of Long-Term Care, and he's actually joining us from the other Washington on the other side of the country. We're also joined by Jim Gregson with Parker Smith and Feek. Jim is Principal Vice President and Account Executive. And last, certainly not least, we have Connie Carroll and Karen Dasek, who are both with Pillar as insurance professionals. I'm going to give Dave, Noel, Jim, Connie, and Karen an opportunity here just to talk a little bit with us about their firms and the services that they provide. So let's start with Connie and Karen first. We'll go backwards.
I think I'm going to answer for that. And Connie and I are the same ilk, so I'll take the lead there. We are a small little firm. We're kind of unique in that we do no medical insurance. We're only advisors for income replacement products. So disability, life insurance, long-term care. We work with individuals and we work with groups. So we're kind of product agnostic when it comes to helping corporations or firms. We like to make sure that the employment contract that somebody signs actually meets the definition of what they're going to earn in the event of disability or an untimely death. So we review contracts for companies. In the long-term care space, we offer both kind of a individual product line as well as the quasi-group product lines that are being offered out there right now. I've got 29 years of experience in disability and long-term care exclusively. These are crazy times, but we're happy to help people get their answers to their questions.
Great, thank you. Let's go to Jim. Jim, tell us about Parker Smith and Feek.
Yeah, you bet. So broadly, Parker Smith Feek been around for about 80 years. There's about 300 of us headquartered here in Bellevue. Really kind of all lines of insurance as you think about court bonds, as you think about professional liability, as you think about employee benefits. That is what we do. I specifically lead the professional service practice group, so focus on architects, engineers, accountants, and attorneys, kind of your real white collar folks. Difficult to attract and retain good employees. Professional liability is kind of the thing that keeps people up at night. So that's what we focus on.
Beautiful. And Noel, tell us about AHT.
Yeah, great. So I am the in-house long-term care director for AHT Insurance, and AHT is based in Seattle, full service commercial and brokerage firm. And I've been specializing just in long-term care since about 2008. I've worked in, I've worked for John Hancock, I've worked for Genworth, and with my role at AHT, I really am helping my colleagues navigate the Trust Act and just find solutions for it. I try to operate holistically, so this Trust Act has created a different way of doing things with different timelines and because everyone's trying to opt out or figure out, is opting out worth it? But my goal here is to provide more, just general information about long-term care, how it works, and how it affects employers and employees especially.
Great. And Dave, tell us about Hub.
All right. So, yes, I've been in the insurance industry for a little over 40 years. And so I've been a generalist. I was with Marsh McLennan a few years back, and I did primarily, so Karen knows that, back in the day where we actually had group resources for long-term care.
We're old, Dave.
We are that. So I've been with Hub for the last 6 years. We were acquired by, I was with an agency here in Spokane. We were acquired by Hub. Hub is an international company, so they have an array of products, both property and casualty, risk management, employee benefits. We do investments, wealth management now. And so we provide those type of services throughout North America. And I'm part of Hub Northwest, and Hub Northwest is the state of Washington, Alaska, and Oregon. And I manage a life practice where I help clients both personally and with their businesses apply protections that are needed. And that involves life insurance and disability income and annuity work, as well as obviously long-term care. And so look forward to seeing if I can be of help today.
Absolutely. Well, great. We are very lucky to be with you today and kind of sit at the feet of your expertise as we, grapple with this new state requirement. And certainly, I want to put in a plug, to our members that, beyond long-term care insurance, you've just now heard the suite of services that are, offered by our business partners. So, by all means, pick up the phone and call them as you have needs. Make sure that you're leveraging their knowledge and expertise for sure. All right, so we're going to move into the program. We're going to do this I'm going to put questions to each of our panelists to kind of kick off different areas of discussion. We will have the chat and the Q&A feature or Q&A features open. We will probably hold the bulk of questions until the end, and Michelle is here with us to kind of help keep an eye on that. But we may insert periodically if there's a very relevant question that it's timely for a particular topic. So if you have questions, by all means, feel free to put them into the chat and Q&A. We're going to try to get to as many of them as possible during our program. We've got 1 o'clock to 1:15 kind of set aside as Q&A, specifically, after the panel portion ends. So with that, I'm going to launch into our first question. I'm going to pose this to Dave. So, for those of us who are kind of just getting our feet wet with this topic, maybe we know nothing about it, maybe we know a little bit. Can you tell us a bit about the new tax and what the requirements are and the timelines in terms of complying with the new legislation? Tell us about who's administering it and what we should be communicating to our employees at this point.
All right, and I'm going to keep, so it's titled the Washington Long-Term Services and Support Trust Act. It is detailed, and all of us have a responsibility to cover some of that detail. So I'm going to give a sort of a summary, at least my condensed version of it, and try not to interfere with others' questions. But this bill has been in the making for the last 6 years, although we're all just becoming aware of it. And Washington State decided that they wanted to be the first state to be offering a public or state operated long-term care services and support, or in this case, long-term care insurance. And the trust is going to be publicly funded program that's going to be paid for by working adults, working individuals of Washington State. And for that, they're going to get a basic level of long-term care insurance. The program will be funded by, as you mentioned, Veronica, the payroll tax. And it's going to be a tax on wages. It suggests W-2, but there are other wages that are probably going to be included based on what I understand. And they're going to be collected by the employer via a payroll deduction. Then the employer has the responsibility to remit those payments, and that will be going to the Washington State Employment Security Department. So the payroll tax is going to be 0.58% of wages. So it's 58 cents per $100 of income. Someone told me recently, and others have probably heard this as well, that Russell Wilson will be paying $174,000 for a long-term care benefit of $36,500. So because there is no cap on the wages at this time as the way it's proposed. So this all begins January 1st in regards to the tax, but there is a timeline that was just passed, a week ago, that suggests we now have up till November 1st to literally own private long-term care insurance to give us the ability to opt out of that payroll tax. And the opt-out timetable, and again, I don't want to hit that because I know others are being asked, but there is a timetable on the opt-out. But we do need to have, or employees will need to have, private insurance in force prior to that November 1st date to even have the opportunity to complete that exemption form. So the state agencies involved, I just listed them, is the Healthcare Authority, the Department of Social and Health Services, the Offices of the State Actuary, the Employment Security Department, and each of them are going to have a distinct responsibility in regards to the implementation of this program and then administrating this program. So communicate to employees. We need to do it as soon as possible. Not only do we have a timeline, I'm sure everyone will agree that there's been a gold rush in regards to people wanting to get this information, and people who are selecting to opt out are inundating the insurance carriers. So we're not only under a time crunch, but we're also under a crunch of what's available out there and how quickly can I get approved. So we need to educate employees as soon as possible. There are some resources that the state suggests are going to be available. I know that they haven't updated it yet, but I know Social and Health Services had a flyer that can be used that sort of does a one-page summary of the program and explains it. So I would get online to do that. Obviously, we in the insurance industry can provide tools and resources to help educate as well. But again, the main message here is get people educated as quickly as possible. There still are a lot of employees who are unaware of this potential payroll tax. And then, through that education, the challenge is how do you do a comparison? And quite honestly, one of my challenges personally in doing this for so many years is, the state plan is a $100 a day plan, minimal plan, but I'm concerned about employees just putting a Band-Aid on this, if you may. My emphasis has been more helping individuals before this abnormal time, as Noel, I agree with you, Noel, this is abnormal. Before, it's helping people to actually have that type of plan in their planning portfolio. And that's still what we're trying to stress out of my division is let's not put a Band-Aid on this and still end up with a lesser plan versus, if this is something you've truly considered, this is the time to probably get it done.
Other panelists, do you want to add anything to what Dave has shared?
Yeah, I'd like to just touch on what Dave mentioned in terms of carriers. How you can buy long-term care insurance is as an individual or through your employer. And there are quite a number of group long-term care options available, but as this began to move pretty quickly after the February meeting with the initial opt-out date of July, which created really a state of panic in the industry because, how so much business was coming in and we weren't sure of how we were going to handle that capacity wise. Some of the carriers were indicating they were going to put production caps on. Now that we have a little bit of a longer of a runway for November 1, there's still some of those concerns. They're not as much. And you know, I think one of the things Dave touched on is like, as a long-term care specialist, I want to make sure whomever I'm talking to is well educated about long-term care. I still run across people who don't know what long-term care is. They think Medicare pays for it. They don't understand how it works. What are the triggers? So one of the things we've done in AHT is we've created some marketing material. We've done a webinar for all of our clients, and we certainly address the tax and the deadlines and how to opt out. But we also try to provide just some basic education about long-term care. Because if anybody on the call has dealt with caregiving, it's tough work. You're trying to juggle a career and be a caregiver. It has a lot of impacts on your employer, on yourself, on your finances, and your mental health. So I do think it's important to discuss, you know, the math problem this has created for certain high earners, and to determine who should opt out using private insurance. But I think it's more than that. I think it's understanding long-term care, why it's important, the impacts it has on families are really, I think, very important.
Other comments on this topic?
Yeah, maybe I'd add that I'm a group benefits person, so I don't have expertise within long-term care policies. I don't have expertise with the underwriting process, and we work really, really closely with Karen and Connie on that. But we're getting asked by the HR teams, how the heck do we communicate this? How do we connect Karen and Connie to our people? How do we get people into this kind of one-on-one conversation, which long-term care kind of needs to have, in my opinion? So that's been, you know, I think the focus of our group over here is, how do we communicate this? How do we get employees some level of comfort? How do we get them a sense of urgency around the timing? And it's challenging, but I think it's been really interesting to see the reaction.
For sure. Okay. Connie, Carol, or anything to?
No, I think that was a good high
I
level
meant to
summary.
say Karen, not Carol.
Hi, Carol, Karen.
Exactly. So we've touched a little bit on the sort of the concept of the opt-out. Noel, can you tell us a little bit more about that? So like if someone already has long-term care insurance, or if somebody wants to get long-term care insurance, you know, what does that process look like in terms of, you know, not only notifying employers, but then making sure that the state knows, you know, not to expect, I guess, these withholdings. You know, are there specific requirements for that coverage? Walk us through a little bit about that opt-out process and what that looks like.
So after last weekend's meeting where they extended the opt-out date to November 1, there's still some uncertainty about the definitions of how they're going to implement that you have ownership of private long-term care insurance. Now, certainly, you know, there are lots of people in Washington State who, before the Trust Act came about, have long-term care insurance. So, you know, not everyone is going to be trying to make these deadlines by buying it now. But again, the conversations have been that they're going to set up a department where there's going to be an online process where you are certified, that you certify that you own long-term care insurance yourself. And then you have a certain window to provide that to your employer to avoid the tax. There's still some uncertainty, though, in our looking at the bill in the last meeting as to what exactly those deadlines are. Our understanding in terms of the insurance that will be acceptable are traditional long-term care insurance, asset-based long-term care insurance. So that's a combination of long-term care and life insurance. Long-term care insurance purchased through your group, and there's group long-term care insurance of all sizes. We do understand that medical subs will not be acceptable, and some annuities are not acceptable. There's still some confusion about those definitions. And so one of the things we're doing pretty much on a weekly basis as information changes is communicating that to our clients. But I think also it's important to think about the November 1st deadline. It's not a good idea to wait till the last minute for this. I mean, as Dave and Karen and Connie know, unless you're buying this through a group and you can get simplified or guaranteed issue, which is available in the market, you're buying this as an individual, you've got to be approved. You've got to be fairly healthy to buy long-term care insurance. That's going to involve medical records. That's going to involve a phone interview. One good thing about long-term care insurance that's different from life is that you don't have to do a paramed in most cases. So typically, if you're 65 or younger, there's no face-to-face component of this. But I had a call this morning with one of my top carriers who said, we've gone from a 2 to 3 week underwriting turnaround time to 60 to 90 days. So people need to be aware of that, especially if they're buying it individually. So I think it's also important for all of us on the call who are specialists and do specialize in long-term care that we help educate people about that piece of it. Because if you wait until October, you're not going to be in a lot of time.
That's right. I'm going to throw in a question here. If an employer provides or pays for a group long-term care policy, I assume it would be optional and the employee could still choose the state plan. How does portability work when the employee leaves?
Karen, you want to talk about that?
Yeah.
Yeah, I'm fine. Once you opt out, so there's a 15-month window that will open up October 1st of this year, and it'll run till the end of December of 2022. That is the window in which an individual who has a policy dated prior to November 1st of 2021 can opt out. And I guess these opt-outs are reviewed quarterly. Okay, so if you don't submit your coverage or you don't log in and tell them that you have insurance and prove that you have private insurance in one quarter, then it'll get bumped forward and you'll still have to pay the payroll tax for that quarter because the payroll tax is also collected by the employer quarterly and submitted. So once you do opt out though, that is a permanent condition. You cannot opt back in. However, and I see Noel nodding his head, it's kind of confusing. What do you do going forward where you're going to have to go to your next employer and prove once again that you have opted out? What that process is still being fleshed out. We're not quite sure. Given that the opt-out is permanent, one wonders, why do you have to prove it again and again and again for every employment situation? But that's what we understand right now. And the only thing that is absolutely determined is that you cannot opt back into the Washington state plan.
So Karen and Bill, I have a quick question in regards to, again, I pretty much understand the traditional and, if the product meets the RCW code of LTC, we should be good. But I'm still not clear on what the benefit amount is going to need to be to qualify for the exemption.
That's a really good question, Dave. And from what I've understood, and Noel, feel free to jump in, you have to equal or better the state benefit level. So that $36,500 benefit pool that's paid over 1 year, the reimbursable paid over 1 year, is the minimum. Now, I'm going to take it one step farther. I'm a little bit anxious that a cost of living adjustment may be required also on a private plan. And the only reason why I say that, if you're going to equal or better the state program is going to be reviewed annually and have the Washington State CPI adjustment made to it, the benefit pool every year. So we could be in a situation, and that's why I've been advising people who are looking for private insurance options, don't call me and say, I want the minimum to get out. We're all nodding our heads. That's not long-term care planning. And actually, that's kind of the antithesis of why I've been in this business for 30 years. And I won't do it. I'll send you to the internet if you want to make that phone call to me.
And another very important piece about that, which no one who's a consumer would even think about, carriers are very concerned about lapse rates. They do not want people to go out, especially on the group side, which takes a lot of resources to get a group enrollment through, to do a minimum plan and then next year lapse it. That creates serious issues in the industry. But also, I think it's important to know that most of the plans in the market that I think we all represent, the minimum benefit is a 2-year benefit. You can't even match the Washington benefit, right? Because we can talk about that in more detail. So really what's on the market is typically a minimum of a 2-year benefit, a minimum of $50 a day. with inflation protection. So we are typically always showing 3% compound typically, which is going to solve for the problem of long-term care, which is not so much what it costs today, but what's it going to cost you in 20 or 30 years, right?
Yeah.
So I think Karen's point is really very spot on. And I have the same attitude. I'm not simply going to do this as a tax dodge. I mean,
Yeah.
I can help create a plan that is markedly better than the Washington plan and affordable. I mean, I think there's a lot of misconception in the public about long-term care insurance is so expensive. Well, it's really not. Now, if you buy it when you're 65, yeah.
Mhm.
And I've had some people coming to me who are in their 60s and are concerned about, I make X, my income is really high. I don't want to pay the tax. So, I mean, and I think in those cases, maybe it makes more sense to be a little more cautious about what we do. But I think Karen's right. This should not be simply a tax dodge, right? I mean,
Yeah.
and I think, Dave, you've been in this a long time. I want to try to help people really meet a need because a lot of people are going to need long-term care.
So Noel, Karen, I hear you, 30, I know we need to meet the pool. And so for those
Well,
out
and you know
there-
what? I also do the daily benefit though. We've
Yeah,
been
I'm the
conservative in
same.
our office
Yeah.
to do the $100 a day. So I'm doing
Right.
$72,000 benefit pools.
And I think, and I asked that for the audience to
Mhm.
understand that, as you might see a proposal out there to have your employees enroll in a plan, a minimal plan,
Mhm.
you best be sure, and none of us are 100% certain, but the way we design the product today, which is exceed the pool that the state offers, exceed the monthly benefit the state offers, put a minimal piece of inflation on it, or if you're using a hybrid product, do a higher monthly benefit so that the odds are much in that employee's favor to make sure they do get the exemption. Because there could be plans purchased out there that don't qualify for the exemption. And I think everybody, in on this agrees. You have to design the plan. It doesn't necessarily mean day one that it's a lesser cost than the state tax, but over a period of time, it will be a better benefit for those employees. All right, I'm down to my podium there.
We have a
I wanna-
question on the Q&A. Can the employer pass the cost of coverage on to the employee, like you do in a health coverage plan at times?
It's actually the opposite. The employee is required for the cost because it's a payroll tax.
Right.
So, the employer then can offer to buy the long-term care insurance. I don't know what they'll do in regards to the tax, but they can offer to buy, a portion of the insurance or all of the insurance to help the employees eliminate that tax.
What is your advice for employees who expect to retire within the next year or 2 or 5 years? Just suck it up.
Well,
Depends on what they want to do.
exactly. I was about to say, it's a case-by-case basis. If you are going to be around, at least initially when this plan's being launched, they are going to vest people if you can pay in for 3 years. Okay, that's the initial investment period. So I talk to people and say, how long are you going to stay? I'm only going to be here a year. Well, then we have a conversation about long-term care planning in general, because you're overdue, right? It's time for retirement. You're overdue to talk about this. But when it comes to a corporate sponsored plan, or should the corporation pick up the cost of the employees program, that's a genuine concern that they should be making. I mean, should they, some folks, if you are lower income, because of course the state plan is based on your income, your premiums based on your income. If you are much older, and frankly, if you're not in the best health, then the state plan is actually an excellent product for you. It really is. I'm not going to disparage the state plan for some folks. It tends to be those individuals who are in the higher income brackets, who potentially are going to retire outside the state and you're going to forego all your benefits. If people want flexibility in their plans, if they want to share a benefit pool with their spouse, if they want a robust cost of living adjustment so that their plan stays in place with in pace with inflation. When you're making all these real planning considerations, then no, the state plan is not going to pencil out as your best option.
And to answer that question, the state plan is not portable, as Karen alluded to. And that's one of the great things about private long-term care insurance, whether you buy it individually or through your employer, which is called group long-term care. It is portable. So if you decided to retire to Arizona or Florida, or you switch jobs out of state, you can take your long-term care insurance with you. So I think that's an important distinction as well.
Right, and I'll add to that, probably a little redundancy, but yeah, the state plan is not portable. And in fact, if you retire or move elsewhere and you're fully vested, it's forfeited. You don't get a return of your premium. And even for private plans, even as the group plans that Noel is talking about are truly individual certificates or contracts. So those go with you to your next employment, your next place of employment, your next state. Anywhere you go, you get to keep those policies as long as you wish.
And correct me if I'm wrong, Karen and Constance and Dave and Jim, I think the bill language is that if you leave your employer and go to another employer, you have to recertify ownership, which would, I think, inhibit people from doing this just to lapse it, right? Because okay,
Right.
That's what I thought.
Absolutely correct. And that's
Yeah.
what I've warned people, and it's been
Right.
interesting that I've talked to one law firm in particular,
Mhm.
that they said, well, we might just put this in place and then we'll let it lapse in 6 months or so after everyone gets their exemption. I don't think the state, now granted, the state hasn't thought of absolutely every little niche that we could wiggle out of, but that'll be a pretty gaping hole that I think that they will address.
Yeah.
And also, as a reminder, if you're self-employed, you don't have to worry about this. You're not subject to the tax. And you have to opt in if you wanted that long-term care benefit, which maybe some people would. I don't know about the number there, but that's another distinction.
I know we're going to have more questions about the, opt-in, opt-out, but I want to just kind of touch on quickly here, are there any other, and I'll put the question to Jim, are there any other sort of like legislative, I guess, gray areas or questions that we have at this point? Obviously, news from last week about the extension of the opt-out period. Is there anything else that's still pending? And also, are there any, I guess, court challenges to this? Because I can imagine that there are people who are motivated not to have this go into effect.
Yeah, that's two really important questions. The first, I think, is pretty straightforward. The administrative kind of framework around this is still very much up in the air. So the state has, as Dave pointed out, going to create an awareness campaign. That's going to start October 1st. They've committed to starting October 1st with an 11/1 opt-out date. So, I mean, it seems unlikely someone could find out about this through the state communications and put together a plan to opt out within a month. So I think there's a lot to be figured out, and we're going to get this kind of spoon fed to us over the course of the next handful of months. What is the process? That's all to be figured out. From a challenge standpoint, I mean, my experience has been pretty straightforward. It has been kind of a universal, this isn't fair. For people who don't plan to retire in Washington, this isn't fair. And there's a really simple nexus between the tax and a benefit, as opposed to just some random tax that we pay. And being a resident of the state of Washington, we get long-term care. There's a tax very specifically connected to you receiving this benefit. And I think that's frankly kind of a political blunder, because it makes this so black and white, who's going to benefit and who isn't. So, kind of easy grid. If you're 25 years old and making $100,000 a year, you're going to pay way more in taxes than you would ever possibly receive in benefits. So doing that analysis, I think, is pretty straightforward for a lot of people. When you create that sense of unfairness, then you start talking about what is, if any, legal recourse. And there's two really strong and compelling arguments. One, our state of Washington does not, the Constitution specifically prohibits a state income tax. Hard to argue that a tax on your wages is not an income tax. So I think a very clear challenge there. And that kind of goes hand in hand with the capital gains tax that's being floated in Olympia right now. So there's kind of this major groundswell towards perhaps a state income tax in Washington that's going to get more publicity. Another an aside to that, it's not getting a whole lot of media attention, and I think that's made our jobs a little more challenging in that there's not awareness. We're bringing awareness, but it's kind of trickling in. And then secondly, if you have any ERISA attorneys on staff, pretty clear nexus between a payroll deduction that is voluntary, between a benefit that is clearly included within ERISA. I think it'd be hard to argue that this is not a state mandated benefit that ERISA preempts. So I think that ERISA preemption case is really strong. It's just a question of someone's going to take it up and how long that takes and what the implications of that would be.
Other panelists, anything to add on the, I guess what are the next steps with this in terms of, potential litigation or, requirements as they are, I guess the state is building the road as they drive it, sort of thing. Is there anything else that we can expect?
Well, I think one thing, and I'm not an attorney, so I've read, Jim referenced the ERISA. I've read a document about that that's floating around out there. But, I think if you have, if you are a business owner and you have offices in other states besides Washington, you should probably consider that Washington State was first on this, but other states are considering it. There's about 7 others that have already been toying around with this. And, when Dave was first talking, he mentioned this has been on the horizon for 6 years in Washington, but the framework is in place. So other states are going to have a much easier job of getting this done, depending on the political environment, the legislative makeup. But my only, I could disparage the Trust Act all day long, but that's not what I'm here for. It is what it is. We need to provide solutions. But my one takeaway is that Washington did not consult private long-term care industry until I think, what was it, December. Had they worked with the industry, I think there could have been some of these holes that would have been plugged. I know in New York State, there's a similar act being talked about. It's called the WISH Act, I believe. And they're engaging with the private long-term care insurance industry. And, Joe Biden's plan, infrastructure plan has a component about caregiving, specifically for home care. And there's a number of senators who have plans out there right now, like Amy Klobuchar, Pat Toomey, they both have plans. So I'm just speaking more broadly. The ideal way to do this would be a public-private partnership, which expanded long-term care insurance and made it more of a mass market, benefit instead of a tool for the high-earning affluent class, which sometimes there's a misconception about that. But I just think that this is being talked about in other states. And again, as everyone on this call who's a specialist knows, long-term care insurance is affordable. I mean, if you buy it at the right time, you're fairly healthy. I'm talking about buying it individually. You'd be very surprised at what a good plan you can get. So I just think that is important to keep in mind.
For sure. Definitely forcing a conversation, for individuals about, how they want to plan for that particular, bad day down the line. Hopefully that never comes, but certainly it is forcing that. Okay, so I want to put a question to Connie. We talked a little bit about, if people move out of state, it sounds like they can't opt back in, and I'm wondering if there's any sort of like limitations on that. Let's say someone leaves for a short period of time, as a resident, maybe for a year, they come back, or, what does this mean for, say, an employee that gets hired from out of state a year from now? How does this all kind of work?
Well, so a few things. To be clear, if you have a private plan in place by November 1st and you opt out, that's permanent. I think we've talked about that a couple of times. You can't opt back into the state plan. If you are paying the payroll tax and you leave the state and you come back, Karen mentioned one of the definitions. They have kind of a funny definition of how you get vested in the plan for Washington State. It's if you paid into the payroll tax for 3 years, or you've paid the payroll tax within the last 6 years, or for a total of 10 years, with at least 5 of those years paid without interruption, and must have worked 500 hours. So in all of our communications, you'll see these definitions. So they can, if you left the state and came back, you could. Now, of course, if you retire then and go elsewhere forever, then you won't receive any benefits for that. So that's on the opt-out part. The other thing I wanted to mention, which I don't think has been brought up, is you can have both plans. I saw Karen ask that. So if you have an employee, a new employee come be hired, if they have private insurance in place and have already opted out, they just need to let you know of the exemption. If they do not by November 1st and they haven't opted out by the end of next year, then they will have to pay that tax. Now, if the employer is offering a separate private plan, they could still offer that, but that employee would still have to pay the payroll tax if they have not put a plan in by November of this year and put the opt out by December of next year. It's kind of confusing.
A little bit. Yeah. My head was spinning when you were describing all of those conditions.
The other limitation I thought I would mention, I saw that question come up, is there, the state plan, to Noel's point, they didn't discuss as much with the insurance industry as it sounds like some other states are. And the definitions for the state's plan versus all other private plans are different, and I would say much weaker. The state's definition as a trigger is 3 of 10 activities of daily living they've come up with, which includes cognitive impairment. Whereas all other tax qualified private long-term care policies have the same triggering definition, which is loss of 2 of 6 activities of daily living or cognitive impairment. And I think that's very important when thinking about planning for long-term care in a private plan versus the state plan.
I'd like to add one more thing to that, Connie. I think it's exactly these gray areas, these gaping holes in the state plan that, as Noel said, there was no input from the insurance community when this was being devised. We were not asked from a lobbying standpoint nor a structuring standpoint to contribute. And it's actually interesting and rather comical that the state did not adopt the tax qualified long-term care language that is a national definition of long-term care accepted by the medical community and is applied to our tax code or federal tax code for tax deductions. So we're dealing with apples and oranges all the time. And I know you're going to hear this a lot, that the state plan, you couldn't even file the benefit and the definitions of the state plan with the Washington State Insurance Commissioner. It would be rejected as inadequate. Okay. Yeah. So you have to wrap your brain around that. So a lot of the planning that we're doing for folks is always apples and oranges. But I think what's going to happen over time with the state plan is it's going to morph and adapt. Just like Noel said, we're one of the first states out there. Hawaii has a little long-term care plan, but we're one of the first states to put our toe in the water on this. And you are going to see pressure annually when this plan is reviewed, not only for additional funding, right? Back in November, we had an opportunity to say, yes, we can invest the funds collected into private investment options. Well, we turned that down, which put the plan or the trust more at risk for being underfunded. Next year, they're going to be looking for additional funding. Noel had mentioned if you're a sole proprietor right now, you can opt in and opt out, or opt out, I should say. Same with general contractors, same with K1 partners. That might be a loophole that is closed next year. They are going to be looking for more and more resources to fund this program. Additionally, I think that the benefit will also be morphing over the years. I think that at some point there's going to be some attention given to $36,500 as a drop in the bucket, or 1 year benefit period when the average length of claim is 2.7 years is not even going to address nor relieve our Medicaid situation, which is part of the impetus behind starting this program. So you're going to see the state plan go back to more funding opportunities, maybe back on the ballot again for private investment options, and changes perhaps in the definition. And that's a real important consideration as consumers. Do I want to put myself with an insurance company with a tested insurance pool? They have data that knows how to price these products. They've been in the long-term care industry, although it's nascent. It really still is, even though it's 40 years old. It's relatively young, but at least they have that actuarial data to price a program. Or do I want to put myself in a pool that's completely untested and has already been criticized by Milliman for being grossly underfunded? It's so apples and oranges, but it's something very, very important for you to consider as individuals and as consumers.
Yes.
It strikes me that I guess the portion of the population that they most need contributing, which is the high income earners in the state, are the ones that are the most likely to opt out and have the means to opt out, which obviously, I guess factors into, modifications that will be made to this over time.
You're absolutely, and that's why it was stunning that the lobbying effort pushed forward the opt-out date to November 1st from July 24th. I was certain, if I were a betting woman, I would have bet the whole house on July 24th. And so it was stunning. And actually, and that truly is, it's a lobbying effort for people to have choice in this state. It's a lobbying effort to make sure that the wealthy do have an opportunity to consider the options in front of them. But it is going to be a perennial challenge to fund this trust. And, this is my little bias, my little aside, but I'm sure my panel will agree. Anytime that the state gets in the insurance business, it's rocky, to say the least. It's rocky and it takes a lot of time to sort it out. And unlike the federal government, that could just print more bonds to fund things, the state can't do that. They've got to actually find the money. So, I'm going to have my popcorn and sit on the sidelines, but I sure am glad that I have private insurance right now.
For sure. Other panelists, anything to add on that? I'm sure we're going to have some more questions here in the short term as we kind of move back to the options and opt-outs. Okay. I just want to take a look here at my list of questions and make sure we've left no stone unturned. We talked a little bit about ERISA with Jim. I think we talked about, I have a question. So if an employer does decide that they want to offer, say, a group plan, do they have to offer that insurance to all of their employees? Can they do some? How does all of that work?
Do you want me to grab that one? I think that was on my list, so I'll grab it. Otherwise, feel free. I tend to be loquacious. So
no, go ahead, because I think it's a great question.
You can offer it and pay for a certain group of individuals. We call them carve out groups, just to use the vernacular if you talk to an advisor about this concept. And a carve-out group could be based upon almost any criteria other than sex or age. So you can have a group of highly compensated individuals who happen to be the ones most affected by this payroll tax.
Right.
Or another thought would be, in Washington State, we're very egalitarian. We don't like to say we're only taking care of our best and brightest. We like to say we provide the same benefits to all. Well, then, you know what? Why don't we present a plan that rewards people for their loyalty within the organization? Maybe folks that have been here 10 or 15 years get a base plan paid for. Completely legitimate And what it does typically when you create this carve out group is it'll trigger those underwriting concessions up to guaranteed issue coverage. Now, keep in mind, like Connie said, all of the group-like coverage that's offered in this market, and it's a very finite market. We don't have a whole lot of carriers. These are still individual contracts with individual certificates. So it's not like HR can just sign on the dotted line and boom, everyone's insured. We actually have to get all those people through the single man door. And so even if it's guarantee issue, it's going to require, are you actively at work and are you a tobacco user? And that's the best case circumstance that any advisor could provide for you. And you've got to have the law of large numbers behind you to get that. So there are group options out there. There are also individual options. You have to understand, as an employer, you are not beholden to paying for a program, nor even providing access for your employees. This is an employee tax. But most of us, and particularly the people that are probably on this presentation today, are here because they want to educate their employees. They want them to know more about it. Absolutely legitimate. And if that just means here are a few advisors, give them a call, figure out what your plans are, you've done more than most of the businesses in this state. I will tell you that. So go ahead, reach out to an advisor, reach out to anyone on this panel. I'm sure they'd be happy to help you. They'll list the options, but you can offer just, here's some individual insurance options for you. And here's some education. We will, as advisors, continue to stay in the forefront of this information machine that's coming out of the state. Right now, the bill is sitting on Jay Inslee's desk. We are 99.9% sure he's going to sign it and not change anything. So the information that we have today is probably going to be what you're dealing with for the rest, up until November 1st. What will change are revisions going forward annually. And don't rest on your laurels by saying, oh, well, our K1 partners are going to be fine because they can opt out. That may very well change next year. And the opt-out date may very well be November 1st of 2021.
In terms of, so, we talked a little bit about, communication with employees and education, talked about that quite a bit. Are there any limitations for employers in terms of, say, for instance, they do decide to offer a group plan, a carve-out plan, what have you, in terms of communicating that with employees, are they advised to kind of stay neutral on that? Are they, advised to, maybe offer an opinion? What advice can you provide for those of us who have to, communicate with our employees about what to expect and, what might be in their best interest?
I will say that from all the calls I've had with on the group side, especially with HR teams, I mean, the first question is just understanding the tax and how it works. And then depending on who's on the call, and I've had a lot of people on the calls who've had personal experience with long-term care. So they're more receptive to, exploring a group option. And then there have been some people who said, well, we don't really want to get involved in this. We're just going to send out a communication about, the deadline, and it's up to you to do it. So I think it just really depends on the company. It depends on who's on the call. But there's a lot of resources in the market. And as Karen said, this payroll tax opt-out is, let's call it, it's November 1. People still are going to need long-term care next year and the year after that, right? And if you're a business owner, there's also tax benefits from offering long-term care insurance. If you pay through the company checkbook, there's tax deductions available, right? So I think one of my frustrations with this entire process has been typically when I do a phone call or a meeting with a client, it takes place over several months. This is all being condensed into like two phone calls, 2 appointments, and it leaves a lot out. So I just think it's important to try to get to be patient and let your advisor educate you and give you information instead of just approaching this from a tax dodge perspective. Because if you're going to do this, you should do it right. I just had a call with, and this wasn't even a Washington State firm, which is a firm in DC, a law firm, and they've got, 50 some odd partners, and they want to fund all of that long-term care premium. And it's based on how long they've worked there, right? But I've been on that. I started that conversation a year and a half ago. I mean, so these conversations do not happen this quickly. And that's, I think, what everyone who truly is a long-term care specialist is so frustrated with, is that the deadlines that have come out of the legislature have made this be more rushed. But we do have time because it's now November. So whoever you're speaking with, try to just dig a little deeper into the planning part of this. You don't want to leave stuff on the table.
Well, and I think, I don't know if it was Noel or Dave that brought it up. I mean, it is true, but also the underwriting line is getting long already, right? So my suggestion would be, do not wait until September 1st, or you might be out of luck. So it's something that you can address. You don't need to address from an employer level, but it's worth, educating and thinking about sooner rather than later, to have your options on the table.
And especially if you're buying this individually and you're not, like Karen referenced, if you're buying this through a group and you have the ability, because of this number of employees, as a certain amount, to get those underwriting concessions. I do this for every individual client. I do a pre-screening tool that they complete to tell me if they're insurable. And I mean, just in the past couple of weeks, I've had a number of people who are not insurable. One key thing is, like, you have to have had a physical in the past 2 years, right? I've had a lot of people that I've spoken to who haven't been to the doctor in 5 years, right? I mean, so those basic things are important to know, because now you have time to go get a physical, right? You wait until October, you're going to be out of luck. And I think it's an interesting question too. If you're not insurable, you're subject to paying this tax. I don't know if that's a legal challenge or not, but you should be really getting getting vetted to make sure you can get the insurance, because it's not easy to get. I mean, you've got to be fairly healthy.
Mhm.
So I just think that's
due to our condensed timeline too. I mean, the employer, obviously employers all have a different attitude about what they will do for their employees. And this comes out just in analyzing this, because I've had employers who say, I'll educate, but suggest they need to fend for themselves. As Karen said, go out online, seek an advisor, someone they know, to decide whether they want private insurance. They can do that on their own. I have others that do suggest we'd like to bring, at least a product in-house that they can make a selection from. And then from there, do they do the carve out, for whether it's time of service or whatever the decision made, do we do that to all the way? I've got one group right now that did the math on their payroll. They realized how much money they were going to be sending to the state in the form of tax. And quite honestly, they want to look at the option that they'd rather send it to an insurance company than they would to the state. So it's all dependent, but I think that there is a bit, it's not something you have to do, but there's a bit of an obligation to educate your employees about it. And then it's those decisions, whether they go out on their own or seek assistance, internally. So.
I think there's a major inflection point between whether you have a budget of $40 or $50 per employee per month to spend on this, or give people information and give them connectivity to the insurance market. If you don't have $40 or $50 a month to spend, I mean, you just kind of have to prepare to communicate to what, I mean, you guys are the experts. 10, 15, 20% of your workforce is not going to qualify. And the underwriting is not, it's not as you're, I think, talking about this earlier, Karen, it's not like buying a disability product at the group level or life insurance at the group level. You just kind of sign up. This is a individually underwritten product. So if there's budget to do that, you probably have some really good options. If there's not budget to do that, it's a heck of a lot more complicated.
Absolutely. I actually have a really hard stop at 1 o'clock, but I wanted to thank everyone for inviting me. talk to your consultants. You know, Jim just mentioned, you know, $40, $50 a head. That's kind of a minimum number because these are individual policies. Talk to your consultant about the tax ramifications of the employer purchasing the long-term care or a hybrid. That's another conversation to be had. All of us are here with education pieces, I'm sure, that could be very helpful to you. But I wanted to thank you very much. And I've got to run. Dave Jones, we're going to catch up.
You reach out to me, Karen.
I will. Take care.
And
Thank
I
you
also
so much,
wanted
Karen.
I also wanted to thank everybody. I do have a hard stop as well, but it was great to speak with everybody, and thanks for making this opportunity available. Take care.
Thank you,
Nice to
Noel.
meet you, Noel. Thanks, Karen.
All right. Well, we can move into our Q&A period. And I know we've had a few more questions submitted. Do you want to read through those, Michelle, and we can work through those? And if you have questions, you know, folks, please pose them.
I think we've already answered the first one on the Q&A, so I'll ask the second one.
Yeah.
If the current rate for the tax is 0.58, when is the review of the rate and potential for being adjusted and raised?
Well, that's going to be the responsibility of the state actuary department, and it will be reviewed. So the plan right now is that the tax will start January 1. No benefits are available until 3 years, so 2025. So, and that is to build a fund to pay future claims. So they're going to need to do the analysis as to whether what they're collecting is viable enough to fund future claims. So it is suggested there will be increases as well.
Yeah. Then the next question on the chat is, if someone has a long-term care policy, what needs to be provided to the state if you want to apply for the exemption? Also, what will that employee need to provide to the employer in order to opt out of the payroll tax? I think you pretty much covered that. It's all going to be online, and then they'll have to bring the certificate to the employer proving that they have the ability to opt out.
Yeah, I don't know that it's been, I think Dave mentioned it's been fully defined. Hopefully it will be fully defined by October 1st. You know, for right now, it says, apply for an exemption with the State Department of Employment between October 1st and 2021 and December of 2022. So I'm not sure the process or exactly what is required to provide has been defined, but we should all know more by October.
And I think there's a record keeping element too there. You know, if you're not remitting the tax on behalf of an employee, you have to keep in their file proof of this letter from the state. Connect with ADP or Paychecks or whomever is doing their payroll and make sure that they've got the coding set up in their system. I mean, that opt-out is right around the corner. So you'd think that payroll vendors need to pounce on this.
We have another question in Q&A. I think you've already touched on this. Can you do a quick recap of who should consider the state benefit versus who should consider private insurance? Why would anyone choose the state benefit?
Well, I could take that, and then Dave, you can pipe in. You know, I think if certainly if you're a lower income earner and or sick, you know, uninsurable, then the state plan may be a better benefit for you. If you are healthy and, you know, plan to earn income for a number of years, then it's likely that a private plan is more benefit for your buck and better coverage.
I'll add to that, Connie, and you know, Jim stated it earlier. If you don't have $40 or $50, that's not just the employer. So if you're the employee and you're at lower income, again, the reality of having a benefit that's available in the private sector, because there is no plan in the private sector that's a $36,500 pool of long-term care that pays $3,000 a month. It's
Right.
minimally a higher pool and pays for a longer period of time. So, which means it's going to be it's going to be a greater cost initially than the state plan. So even employees who don't feel they have those funds and want to budget for it are not going to participate in the private insurance. And they'll stay in the state plan.
If someone is working as of January 1st, 2022, does not opt out, but retires within Washington before 2025, will they qualify for any benefits? If not, do they still need a private plan to opt out?
I believe the answer is they won't vest in the state plan because they must have paid into the payroll tax for 3 years to vest. And they would still need a private plan to opt out. Do you agree, Dave and Jim?
Mhm. Yep.
Yeah, this person doesn't get any benefits.
Right,
But still required.
Correct.
right.
Yeah, must pay the tax. And Michelle, can I add a question? I may have read between the lines or may have gone too far with this in the chat, but my perspective is that you can lifetime opt out of receiving any benefits. But if there's some mechanism, if you change employers and you have not kept your policy in place, you can opt out of the benefit permanently. But I think that you won't be able to opt out of the tax permanently. So if you try to game the system, you may be looking at this as, yeah, I opted out. The state says, yeah, you opt out of the benefit, but we're going to opt you back into the tax. I could see that happening pretty easily.
Well, and I think all of us advisors on this call absolutely don't really recommend against that. I mean, proper long-term care planning is a good thing. And if you do put a private plan in place, maybe down the road, but I wouldn't put it in place and drop it and hope there's no catch you later on, because there may be.
Exactly. Yeah, just because there's not the mechanisms kind of spelled out now for the annual attestation or the attestation when you change employers, it's not to say that won't be, as we've all talked about, the funding for this is really kind of in a tenuous situation. So finding sources of money is going to be one of the goals of the administrative kind of proceeding.
I have another question that just came in. If the employee chooses to opt out initially and then later their employer offers to pay the tax for the state program for all employees, they still cannot opt back in, correct? Or would there be some sort of change in stances, allowances to opt back in?
Yeah, there's no opt-in. Once you've opted out, you're not eligible for benefit. But as Jim is saying, and I hadn't thought about this, that doesn't preclude you from paying a tax in the future, possibly. So we don't know how the state's going to audit this.
Yeah, exactly.
And we don't know how long they're going to accept a certificate. If you get the certificate because you did opt out, how valid is that certificate 5 years down the road when you change employers? I'm not sure if it will be or not.
We haven't gotten the question about people who live in Washington but work outside the state, or people who work in Washington and live outside the state. You really have to be paying Washington payroll taxes, and you have to reside in Washington to receive the benefit, period. So, we deal with Spokane and Coeur d'Alene and Vancouver and Portland. There's some funny circumstances there that you just kind of have to pay attention to.
Mm-hmm.
So in those cases, you're stuck paying, but you won't
Yeah.
get any benefit.
Yeah, and that was my comment about the fairness and the direct connection between the tax and the benefit. There's some real kind of obvious, you think about these one-off scenarios, and there's lots of them.
Do any of you have just like a cut and dry little flyer, informational flyer that could be sent to employees, just purely with information, not overloading them with information, but making them aware? Or a location we could get one?
Yeah, you bet.
We do.
Multiple.
We have I'm sure we all do, and we have a one pager as well as an FAQ, which I think kind of covers the most common questions. And I'm sure, it's been mentioned, we have a employer portal we've built for those employer that want to sponsor a plan, even if it's a carve out and or voluntary. But I'm sure we all have a number of resources for you all to use with your employees.
Got another question that came through on chat. Am I understanding correctly? Just minimize. Am I understanding correctly that individuals must have a long-term care policy with a $36,500 annual benefit to opt out of the state plan, even though the state plan is a $36,500 lifetime max?
Yeah, the way the private works, the state plan is, it's $100 a day benefit to a maximum of in 1 year of $36,500. I think we all agreed on the panel that the plan should have at least that, and in traditional plans there isn't that. So the minimums are greater.
2 years.
And you have to, your plan has to at least pay the $3,000 a month. And I agree with Karen and Connie on this, that you probably need to either have a higher benefit or put an inflation provision on there to be safe to get the exemption. So it says it has to be equal to or comparable, but they didn't define whether that's the pool of dollars or whether that's the monthly benefit, and whether that includes the CPI that's suggested in the state plan. So we need to do anything we're doing for clients so that we don't get into a risk of no one being exempt, as we've got to offer a higher benefit than that.
One quick
Oh, go ahead. Go ahead, Michelle.
One quick question I have, and speaking for my office in particular, we're all aging rapidly. So what are the health conditions, briefly, that make you uninsurable?
It
Sounds like a
depends.
tobacco user might be one.
It literally does depend. I mean, obviously the cancers and heart disease and those
Mhm.
can be a major factor. Diabetes can be, but
Diabetes.
there are carriers that depending on the type of product, so like Noel said, he does that pre-screen, and in that pre-screen, it doesn't necessarily eliminate someone from getting coverage, but it may mean you have fewer carriers or type of products to go to. Is that,
Or may have to pay more for private coverage?
yeah, it's typically not rated that way.
Right, it's not
Oh,
rated
okay.
that way. And to Dave's point, it is really kind of complicated, because I was just talking to someone this morning about being pregnant, but which doesn't necessarily knock you out. But some of the programs that have simplified issue might have these boxes to check. Some of the fully underwritten hybrid products may have different underwriting guidelines. So it is really a case by case basis. And I have had companies say, our top guy has this and this and this. What plan should we put in place? So it's tricky. The underwriting's tricky, and it depends on the scale and the product, and it varies.
Okay.
We've got 1 minute left. Last call for questions. All right.
It's quiet.
Very quiet. I think our heads are spinning collectively.
Mine is.
I mean, to kind of sum it up, we've got a lot of answers today, with the benefit of our panelists. So thank you. And there are certainly more questions as we head into the next several months, but certainly start communicating with our employees, and don't wait. Start exploring the options now and be prepared. So for our members, just a reminder, our business partners represented here are here to help us. So, by all means, please, get in touch with them. We've got our business partner directory with all of their contact information, and by all means, they are here to help us. So I want to thank our panelists. I want to thank Michelle. I want to thank Melissa for assistance with today. And thank you everyone for joining us. And I hope you all get out to enjoy the last of this sun. I know it's starting to fade over the next few days. So get out there, enjoy it. And thank you so much.
Thank you.
Thank you.
Thanks, Veronica.
Have a good day.
Bye. Thanks, Melissa.
See ya.